Hey, Nicotine, I didn't get a chance to respond to your very honest and candid video a few days ago about your experience as an adolescent with psychiatry. And I also appreciated your defense of psychiatry that I'm responding to now. Um, and I, in large part, agree with you that we need to take psychiatry serious, even though it is a young science and it sometimes fails or even makes worse the psychological issues that we as persons deal with. Um, Given that it can make mistakes, I think overall we need to appreciate um, the power that it does have to heal us, though obviously it's always a work in progress. Now, the thing that I would say we ought to be careful about in regards to psychiatry, though, is this tendency to treat the person as a brain rather than as a person. Um, a psychoanalyst, um, as opposed to a psychiatrist, is going to deal with the person using talking therapy, though for the psychoanalyst, talking is far more than just the exchange of um, sound waves between people about sort of um, information that's rather ephemeral, um, at least in relation to the actual physiological, chemical um, problem. But of course, the psychoanalyst sees language as something rooted far more, um, something rooted far deeper in our being as human beings. For the psychoanalyst, language becomes and culture becomes the basis of everything, rather than the so-called physical world. The psychoanalyst, you know, understands and hears all of the scientists' very useful remarks about the nature of reality, but says that's all culture. You are first, as a scientist, a psyche, and so you encounter a world that you already care about and that you need to understand in a meaningful way. And from that, you derive all your scientific knowledge. The motive for science can only be explained psychologically, not scientifically, if by scientifically we mean physiologically or reductively. That's the psychoanalyst point of view. The psychiatrist is trying to be more of a scientist um, by looking at the person as a brain and psychological disorders as imbalances in neurochemicals, or perhaps, a physiological malfunction in the very structure of the brain. Um, and see, that's not false. It's not untrue that the psyche is related to the brain. It's just that the psyche is more than the brain. If you're going to do psychology at all, you've got to pay attention to that aspect that is not physiological, um, but that inhabits the physique and sort of gives rise to the personality. It's like the psyche is the soul, and in our materialistic secular age, we kind of have an embarrassed relationship with what we call the soul. Um, some of us deny it outright. Some of us don't quite know how to explain it, but we find it, um, you know, irrevocably a part of our lives. Um, and I think, we obviously can't understand it as some magical substance hovering above the body in some way. It is, at least, if I talk about the soul or the psyche, I'm talking about something immanent in the body. It's not separate from physiology, but at the same time, if you only look at physiology, you won't see it, um, because it is that which feels the body from the inside out, that which sees, that which allows us to look at the physical body to begin with. Because, as I said, from the psychoanalyst's point of view, and I tend to agree, our scientific empirical investigation of a world is not reducible to that world, because to even understand the motive to gain knowledge of this construction we call an objective world, we've got to do psychology. We've got to look at the scientist as a person and ask, why is it that they need to understand? Why are they driven? So this tendency to reduce the person to the brain, I think, is the danger of psychiatry, because then we don't ask questions like, well, why are so many adolescents depressed? Why are so many adolescents hyperactive? Instead of answering those existential questions, we may too easily turn to psychiatry to give us a mechanical fix. And I don't think that's really addressing the root cause of the problem. So basically this gets back into what we were talking about reductionism and the dangers of reductionism as something more than a method. Applied as a method, I think reductionism can be useful when the psychiatrist says, all right, you're depressed, let's look at your lifestyle, but I'm also going to prescribe you a selective serotonin reuptake inhibitor just for a couple of weeks to see if it improves your state, or but the funny thing is, all the testing that's been done has shown that a placebo sugar pill that the patient thinks is an antidepressant works just as well as the antidepressant, if not better. So you have to question then, I think, the true relationship between the mind and the body. Though again, I wouldn't want to separate these things. It's just that if we aren't careful, we can end up forgetting our own point of departure when we try to understand our experience. We may think that science is completely objective outside of our own individual personal experience or the personal experience of the scientist. And the reason, Nicotine, I actually appreciated your first video was because it showed the connection between your biography and your philosophy. You went right from giving us your story to, growing up, to giving us your mature philosophical outlook. And I think any philosophy that's not at least acknowledging the autobiographical component is not really relevant, because it's not authentic. So, when I say we shouldn't forget our point of departure when we're doing philosophy or science, I mean we should take into consideration that the fact that we come into a world that we automatically care about and have to find ways to live with wholesomely, that comes before any knowledge we may have of some world independent of us, and that any knowledge we do gain of a world is always something that we've gained because of something we care about. The world, therefore, isn't ever going to be something objective for us. Rather, it's not merely subjective, because certainly we interact with other people who we can't control based on what we desire. So the world is objective in that sense, but not in the materialistic sense that we will ever arrive at some truth independent of meaning or value, or our own personal existence in the world and in a culture with others. Yeah, so hopefully that's not too difficult to follow, but I appreciate, again, your giving us some insight into your own personal history and sharing the insights that resulted from it. So, yeah, take it easy.